Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The beauty of the opportunity is that we have dental students out treating migrants, and in treating migrants they are undergoing a educational experience, and we are able to spread the arm of the University of Michigan and provide an excellent service all around.
Dental education, at its best, includes more than just reading books, learning techniques, and perfecting clinical skills. In order for students to become well-rounded and socially aware dentists, they must know something about the community and its surrounding environment. The current trend in dental education is to involve students in clinical activities that take place outside the School of Dentistry. Putting students in touch with patients in varied environments has helped them gain a wider perspective of patient care and interpersonal relationships. For several years, students have worked in various local facilities in and around Washtenaw County. By participating in these field experiences, dental students observe the relationship of dental problems to individuals and social groups. Now, through the use of 2 mobile dental clinics, the students at the University of Michigan have the opportunity to expand their involvement with communities as far as 300 miles to the northwest of the dental school. During the summer term, volunteer senior dental students travel to the Traverse City area in northwestern Michigan to provide a variety of dental services to migrant workers through the Northwest Michigan Health Association Migrant Program. Getting ready for this summer program is no small task. The equivalent of a 6-chair clinical facility is assembled and transported in the mobile vans to the communities where the migrant families are located. Each van is completely independent and contains modern dental equipment, supplies, and services for the operating teams. In addition to being an agricultural area, northwestern Michigan is a beautiful place for vacationing, which makes working here during the summer even more pleasant for the students and faculty. After working hours, the long summer days afford plenty of time to enjoy the many activities that the Traverse City area has to offer.
If we got out of work early enough, we could go to the beach, and one of the guys had a cottage not too far from where we were staying, and he had a sailboat. We went sailing a few times. Then we had a few activities, night activities, plenty of bars and a lot of activities with bands and etc. And we had no trouble at all having a good time after clinic hours.
During their stay in this area, the students are provided with complete living accommodations on the Northwestern Michigan College campus. The relaxed college atmosphere and the modern dormitory suites provide well-deserved relaxation for 8 to 10 dental students who are spending their 2-week rotation in the migrant program.
The dorms were, I guess you might say, typical college dorms. We enjoyed the particular location, being on the same floor with all the girls.
The mobile vans are stationed at schools in and around the Traverse City area. These schools are used by the Migrant Association for their summer school program for the workers' children. The vans remain at these sites for several weeks, and the dental students travel by car to the work sites every day. Operating the program at these schools allows the patients to be more accessible to the dental units and allows them to attend the mobile dental clinic during school hours with a minimum loss of class time. In the vans, faculty advisors work with the students and help them plan and deliver services to the patients. The advisors are continually available to assist students with individual case consultation. The spectrum of services provided includes preventive, surgical, and restorative dentistry.
Oh, the services that we provide basically were operative procedures, occasional perio procedures, and minor surgical extractions. We provided a service both to children and to adults, and 2 evening clinics per week sometimes.
This innovative program came about when a need for dental care was identified by the Northwest Michigan Health Association in Traverse City. The association's director, Mr. Dale Reamer, worked with the Department of Community Dentistry at the University of Michigan. The department chairman, Dr. Robert Bagramian, made arrangements for students to participate in the summer migrant program for college credit. Most of the logistics of the program were organized in the spring of 1978 by telephone between the two cities.
We got involved in the Traverse City migrant program, and along with that with Mr. Dale Reamer, as a result of my interest in expanding the program. I felt that the program should be expanded and we needed some new directions, and so I was put in touch with Mr. Reamer in Traverse City about 3 years back, and in talking with him over the phone became very, very excited about the possibility of having comprehensive dental care provided to these migrants that would come up to the Traverse City area. And so it was a series of phone calls that we had back and forth, and then I made a couple of what I would say lonely trips to Traverse City in January and February of those particular years, and met with Dale Reamer, and I met with his medical board, and we laid out a plan, a proposal, if you will. We asked for quite a bit of financial support to provide for the program, and they made a decision at their board meeting that they would commit funds and that they would commit staff to support this program. And we made plans together and had several trips up to the Traverse City area again in the early spring to pick the sites that we would work at and to really try to get the program off the ground.
In June of 1978, the migrant program became a reality. The University of Michigan Dental School became the principal provider of dental services for a nonprofit health association. The majority of migrant workers following the harvest times northward come from Texas or other southern states. In the Traverse City area, the migrant workers come north to help with the harvest of cherries and strawberries, the area's two principal crops. Although the migrant population peaks in July, enough families are here from June through August to allow the operation of a day school program for those children too young to work. Most adults speak English, but some of the young Mexican-American children speak very little English. All written forms are provided in both Spanish and English, and the dental students quickly learn helpful Spanish phrases.
Or the fact that there's a different culture really isn't that great a difference. In fact, once they get into working with the children, they find that there really isn't that big a difference at all. The idea before you get there is the fact that perhaps it's a great cultural difference. They don't know exactly what they're expecting working with another culture, yet it really is a very easy experience and a very educational and profitable experience for the students.
Now a successful field experience, the Migrant Dental Program provides many things for many people. For the Northwest Michigan Health Association, a dental service was found that provides more care for less money than equivalent care would cost from private practitioners. For the migrant families, much needed and readily accessible free dental care is available. For the dental students, a chance to work with another cultural group, to bring dental services to the people instead of bringing the people to the services.
One of the most enjoyable things I found was working with the children themselves. They came from a little different background than I was used to working with. It gave me a refreshing change and a different insight. Many of them were very frightened of the dentist, and it was very gratifying to see the change when they saw that they would receive good care from people who really did care.
This extramural community activity has also provided the students with valuable clinical experience.
And as a matter of fact, we did some procedures that probably we would not get experience doing otherwise. Most of the patients that we treated had rampant decay. Most of the patients we see here at school are not in that state of oral health.
The Traverse City project has been a favorable addition to the ongoing activities of the Community Dentistry Department that are designed to expose students to the variety of needs that exist in the real world around them.
They're very eager to learn, and so they give a lot to that particular situation. They'll spend a lot of time with a child, for example, and trying to allay their fears. They'll spend a lot of time with an adult trying to teach them oral hygiene procedures. So they really enjoy it, and they really get into it in a very meaningful way. I think it gives them an opportunity to be a dentist, a professional, and to take some responsibilities on their own, and they really sort of blossom with that.
The proven success of this program has ensured its continuation in the future. People helping people provides one of the greatest educational experiences there is. Fortunately, the University of Michigan is putting this idea into practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.